All right, it's the AM show, some 22 minutes after 7. We'll talk about the psychiatric nurses issue and the psychiatric hospital in a bit with the PRO of the Ministry of Health, Tony Goodman. But first, we want to take some messages.
All right, a few of your messages coming through, and this one says, okay, you haven't seen any NDC poster with the vice president. I don't know what that's got to do with
Maybe
anything.
when we hit the campaign trail, then you can tell us about the things that you have related
but
to
a
the
lot
campaign.
of your messages coming through, and well, someone is also talking about the psychiatric nurses. We're just about to discuss that. This one says, I can confidently say victory is looming. Well, he thinks the MPP will be victorious come December 7.
Okay.
And you're asking President Mahama to advise himself. The people of Nankpadri and Buprugu have shown it clear. Bien, all right, we know that the vice president was in Buprugu, and oh, interesting. And this one says that newly trained teachers are suffering. You want to know when you will be paid. Kindly remember to add your name and location to your WhatsApp message. This one says, good morning, Mama V. You want us to talk about the deplorable state and low quality of the Kaswato Booth Bypass Road, which links the Winneba Road. Okay. All right. Okay. We'll take a look at that and we'll see what we can do. This one says, Mama, we don't mind these MPs. I'm sure it's when you says, do they know how much salary I take for working for 13 years?
Yeah.
And well, Chemical thinks they're greedy.
Okay.
He's saying he's a teacher.
All right.
At Nkonya, says don't mind these MPs.
Okay, Dennis, we'll come back.
All
we'll
right.
come back
To
to
the
that,
messages,
to the
yeah.
messages and that conversation. I want us to speak with Mr. Tony Goodman, who speaks for the Ministry of Health on the striking psychiatric nurses, the Accra Psychiatric Hospital. Mr. Goodman, good morning to you.
Good
Thanks
morning.
for your time here on our show. I hope you're well.
I'm good.
So if I get the counting right, I think it's day 4 with these striking nurses. What's the deal? How is the ministry resolving it?
Good morning to our listeners. Good morning to you, Mama G. The issue has been resolved somewhat.
Mr. Goodman, I know that it's still a bit early, but can you kindly speak up a bit for us so we can hear you better?
Yeah, because I'm still growing, so my voice is still breaking. So
Get some hot water and drink.
Yes, I'm saying that we've sent a cash of 300,000 Ghana cedis to the hospital, and we've also procured under certificate of urgency 100,000 psychiatric drugs for the Accra Psychiatric Hospital, so that will take care of the current situation. And we've also taken some stock there, and we are aware that they have some consumables that can last till next year, May. So that is where we are on the psychiatric issue.
Okay, so this amount that you've given, is it something that can be able to take care of the immediate challenges of the facility?
Yes. It will be able to take care of the current situation. So about the end of this year.
Mr. Goodman, so you knew you could do this. Why wait for the nurses to strike before taking this action?
We mentioned that, you see, psychiatric medicines are not on the market for you to just go and buy. And you have to go through some processes and get some medication. I mentioned the last time that some processes delayed us, and we got where we are now. But those are things we all will have to know, that because, you see, you are moving from a phase. Psychiatric care was not an issue in the past because nobody cared to even look at it. We have been dealing with psychiatric care in terms of, the Ministry of Health. We've taken care of this 100%. They don't pay anything. Even though you are aware that some facilities collect some amount of money from persons who go there. And if you ask them to really account for this money, they tell them will not collect anything. And your TV station recently even published some new rates in some of the facilities. But I can tell you for a fact that we have been taking care of patients there. Most of them were abandoned by their relatives. And we decided to go into an act, get a law that has to regulate that sector. So in the face of getting the law, establishing a mental health authority, trying to get a dedicated source of funding for that institution, doing the discussion here and there, you were caught up in that gap. The money wasn't flowing, and you had to now continue taking care of that place. Your budget you had to now make sure that you use part of that your budget to resolve that institution. The institution was under Ghana Health Service in the past. It moved from Ghana Health Service, and you have to now deal with the transit, moving from Ghana Health Service under an authority. Where should their budget fall and all that? So there are a lot of things that happen and we go to where we are. But going forward is going to help all of us. It's going to clear this problem, this long-lasting problem we've had, and we're going to have a proper psychiatric management in the country. As I keep saying, if you don't have a dedicated source of funding, you would, no matter the amount you give to that facility, you'll still be where you are.
Yeah.
Because it's an institution where you have taken a responsibility to take care of people, irrespective of whatever they go through. If the person has to go through a secondary care or tertiary care, which is surgery or any other thing, because that patient is in the facility, you have to look for the money to do that surgery or whatever you want to do.
So, Mr. Goodman, not to cut you, Mr. Goodman, where is this money coming from? Is it from the authority or this is directly from the Ministry of Health?
This is coming from the Ministry of Health.
Okay, so
we were given some amount of money. As you may be aware, His Excellency the President mentioned that he wasn't aware. We're pulling this money from, a source where we all get our funds from. So we got this money from there.
Mr. Goodman, what's the well thought out plan for next year? Because you said this amount that you've given, you've assured us that it will be able to take care of the immediate needs of the facility, and it's till the end of the year. So what's the plan from January?
The plan is what I was talking about, that you need a law that says that, okay, like what we have in the health insurance, they have VAT and other source of revenue prescribed by law. Mental Health Authority should also have that, because you now have the Mental Health Fund saying that there should be a dedicated source of funding from government and then other source of funding, which is going to the corporate Ghana, talking to individuals, having institutions to also support, backed by law. So that is where we are.
But Mr. Goodman, the ministry has a budget and the authority is under the ministry.
Yeah.
So why can't you take care of the authority with the budgets that you have?
You should agree that stakeholders sat down and agree that the budget line thing will not help. If you want to solely depend on your budget, you'll be in problem. The budget will come anyway, but the VAT, the tax, and other things that will be sitting down there for you to know that by the end of, like how Get Fund and other funding comes, you know that today I have this amount of money sitting down there. So we plan towards it. With the budget, there is what you want. There is one portion of it. It comes in three phases. You want so much, but you are given a ceiling. And then at the end of the day, there is some actuals you get. So you cannot solely depend on budgeting. Psychiatric care, since you said it's 100%, like any other facility, they can generate some small money to take care of other issues.
So if I hear you correctly, are you calling for us to pay some extra taxes to take care of the Mental Health Authority?
I haven't said that. That is being done by the ministry, the authority, and
but
the Ministry
is that one of the things that they are looking at?
Yes. Currently, I think we've gotten to a closer point where we can break that deal, where a source of funding is being looked at, either the petroleum levy or other source, which is being looked at. The reason why the airline even delayed is because we want to get that into the airline before it goes through Parliament.
Mr. Goodman, my understanding again is that the president gave the ministry some 7 million. So I'm wondering why you're giving only 300,000 to the psychiatric hospital.
Please, where? Where is this 7 million coming from?
No, that's the information that I just got. So if it's not correct,
I haven't heard it.
Okay.
I haven't heard the 7
All right.
million.
Okay.
The money I'm aware has gone to a psychiatric hospital is what I'm telling you.
Okay.
I'm aware the ministry is cash-strapped because we had to also take care of other facilities. So we had to go back to finance to actually make some of those cases clear to them. That was where we got this money. If we had money sitting down in the Ministry of Health, why not? Would have gone to even take care of some of the things they mentioned. So, you see, for us, we are a mother. When the money comes to us, we quickly have to send the money to our agencies because we don't do service delivery. The service delivery angles must take the money, and then we just monitor their activity. Where there is a need for money, we go back to the Ministry of Finance and say, okay, this agency needs this amount of money. Can you please help? So this is how it works.
So, Mr. Goodman, when should we expect the nurses back at their posts?
And that they will determine that. But as I said, we have made these donations to them. We are sure that this would meet their demand, and as quickly as possible, they will go back to take care of our patients.
I was just reading a while ago that the NLC has ordered the nurses to go back to work. Did you, as a ministry, forward this to the NLC to take this action?
Oh, no, that is their mandate. You know, the labor law enjoins them to do some of those things. And yesterday, where the mental health authority was there, the Accra Psychiatric Hospital was also represented. So they are only doing their job. So nobody will tell them to actually act on some of those things. They pick whatever is happening and act. This is not the first time.
Were you at this meeting called by the NLC on Wednesday?
The ministry was represented.
Okay, but you still can't say when the nurses are supposed to be back at posts?
No, you see, for us, we've done what we have to do. We've done, we've given the supply. They can tell you that, okay, we'll go tomorrow next. That they've not communicated to us. Because, in effect, the hospital is not even directly under the Ministry of Health. They are under the Mental Health Authority, and the management in the hospital and Mental Health Authority will have to look at this and report back to the ministry.
Mr. Goodman, finally, what's your understanding of how the facility is managing with the situation?
In terms of?
In terms of filling in with nurses taking care of the patients who are still at the facility and admitting new ones?
I don't know. You can ask some of your reporters, including Kojo. I have been there since I was even there yesterday. I was there with Kojo and Co. So it's an eyesore. It's not one of the things one will want to wish for any relative or his or her. It's just not a good thing to have patients placed at the custody of their own colleagues. It's just not the best. But we will talk about the excesses after. We'll talk about what actually the issues are later. We'll talk about management later. Because I just mentioned to you that you will hear the nurses say on radio, TV, that they don't have even gloves to work with. I can tell you that there are gloves sitting down there that can last to next year, May. So there are other things we'll look at. But in the midst of the hate, we'll not talk. We'll not let it look as if we want to look at.
But one will be wondering, why would the nurses lie about things that are available but they say are not available?
Management. You can ask them. There are gloves that can last to next year, May.
Mr. Goodman, we'll leave our conversation here. Thanks for your time this morning.
Thank you, my pleasure.
That's Mr. Tony Goodman. He speaks for the Ministry of Health on this issue. But back onto the story here on City FM Online, which says that the National Labour Commission has ordered nurses at the Accra Psychiatric Hospital to call off their strike and resume work with immediate effect. The direction follows a meeting the commission had on Wednesday with the Ministry of Health, representatives of the nurses and authorities of the hospital. So we'll find out if the nurses are back working today at the facility, if they've heeded to the calls of the NLC, and what happens if you know they don't do that. Well, the PRO for the striking psychiatric nurses says he's been ordered not to speak, but he won't tell who gave that order to us as well. So they are not speaking. So I guess our best bet is to touch base, go to the psychiatric hospital later this morning and see if they're actually on the ground working.
But someone sent an interesting message, and Neokai is asking, and he says that he just read this particular story we shared, and he's asking if you're going back to that same dangerous environment, and he says that he can't think far. He does not think madness because the psychiatric nurses are on strike.
Well, so the woman says they've been given some money. They've given some money. They're given
300,000. He mentioned.
Yes, but he says they can take care of the facility till the end of December.
But you know, they owed the facility some money. They gave them, I think, about 1.5. I'm not too sure about it, but it did not even settle the debt.
Yeah.
So, you know, you're asking yourself, what's this money going to do? And this one says, I don't know the part of the world we live in. Government, through the Ministry of Health, issues a memo to all government hospitals to stop taking consumables like gloves from student nurses who visit the facilities for clinical practice. But these hospitals are still taking them. Says it's putting some financial burden on the students. So I'm sure you're a student yourself, because you say we the students. Says since we are not getting any allowances as well, no medical student or other students can come who come and bring gloves before they are accepted. Only student nurses, says God Help Ghana. Kojo Bintum is sending us this message from the Eastern region. So I don't know what it is like. Maybe, okay, student nurses are coming, everybody bring one pack of gloves.
I can't think far. Well, Mr. Goodman is disputing that anyway. He thinks that there are still some items that could last for a while.
Yeah.
But I don't know, what did the nurses stand to gain
really
from lying, from saying
exactly, and we need to find out pretty shortly. But a lot of your messages coming through. This one says, I wonder how Ghana would have been without industrial strikes. God have mercy on our dear nation, Ghana. This is Xavier Sabaklai sending this from Wasa Ikropong.
Good observation.
Good observation. And it's got me thinking, really, what would they have been?
Yeah, they would still stay in the facility and be doing this work. I mean, yeah, and nobody
would be running smoothly.
Yeah, exactly.
Yeah.
Okay, well, it's some 40 minutes after 7. We welcome your comments still on the issues that we're discussing today on 0560 800,000. Still ahead, conversation that I'm looking forward to is a recent study which tracked students from their late primary years until well into adulthood, which found that kids who frequently break the rules or otherwise defy their parents often go on to become educational overachievers and high-earning adults. Children between the ages of 8 and 12 years old were evaluated for non-cognitive personality traits like academic consciousness, entitlement, and defiance. 40 years later, researchers checked back to see how they turned out. And we'll have a conversation that you won't believe it. People turn out really well. Just
and you know what we say about them? Like, this guy was really bad in school. How did he end up like this?
Yeah.
You know?
Well,
maybe then it is something to look out for in those kind of people. That's how they are when they're young. You know, people have the potential to excel, are usually very adventurous, would usually want to, you know, and because they are not the very type that you say do this and they do it. They want to question it.
Yeah.
Why should I do it?
Yeah.
Why do you want me to do it?
Yes.
And so by the time they're old, they still question things and then they grow up with that. But it'll be an interesting conversation to have.
Yeah,
anyway.
it would be, especially when we have somebody who was very stubborn himself growing up. People didn't think he would turn out to be who he is today. I mean, yeah. Okay, so that'll be an interesting conversation. I was a tomboy. I guess I was stubborn.
Yeah, no, you
not really.
Do you
not
know
really
you
stubborn.
guess?
I think I question a lot of things as well. Yeah. Oh, Patrick Gomez, let's do some girly chats.